Welcome to Mental Health Matters. I'm your host, Chris Garrett. We're glad to have you join us for this edition of Mental Health Matters, being brought to you by the folks at the Center for Life Management in partnership with the folks here at Dairy Community Access Media. For our first segment today, we welcome Dr. Ken Brown, Medical Director at the Center for Life Management. Dr. Brown is going to talk to us about the signs and symptoms of depression. He'll also be offering information on traditional treatment options, as well as a promising new treatment called TMS therapy, which stands for transcranial magnetic stimulation. Later on in the show, Todd Donovan will be joining us. Todd has lived experience with depression and will share his insights on coping with depression. Dr. Brown, welcome to the show. Can you tell us a little bit about what brought you here and your experiences up to this point?
Certainly. I've been with CLM since about 1998, helping out as staff physician there, child services as well as adult services. Became the medical director at the beginning of this year. I'm also affiliated with Hampstead Hospital and have been with them since 1996. I did my undergrad training at Tulane University in New Orleans, received a degree in biomedical engineering, and then did medical school also at Tulane. And then went to Charleston, South Carolina, to Medical University of South Carolina for my psychiatry residency, and did my child specialty at University of Miami.
Well, that's a pretty special resume you got going there.
Thank you.
Well done. Congratulations.
Thank you.
Now, we are talking about depression, one of your specialties. How common is depression in adults today?
Depression is pretty common in adults. The numbers range from the National Institute of Mental Health. They'll report 7% to 10% of adults have depression in a given year.
Okay. Now, we're talking about depression. Are there any common triggers for depression?
Depression can be brought on by some triggers, some life stresses, but also can be brought on out of the blue as a biological manifestation as well.
Okay, so can you tell us symptoms people should look for if they suspect a loved one might have depression?
Certainly. Depression is different from just common sadness that we might experience from certain reactions that occur. Depression is a medical condition, and typically, by definition, it's symptoms that are occurring predominantly more days of the week than not. It's at least 2 weeks, and especially when you're going to 3, 4, 5 weeks, we get very, very concerned. Some of the symptoms are sad mood, agitated or angry mood. Sleep disturbance can be more sleep, craving sleep, or decreased sleep. Appetite disturbance, either increased appetite or decreased appetite. Then there are other symptoms of lower energy, concentration difficulties, feelings of hopelessness, helplessness, worthlessness, guilt, decreased enjoyment in activities that used to be enjoyable, more isolation as well. And then in the extreme cases, which we'd consider an emergency, would be suicidal ideations.
Right, now we'll talk about adults, obviously.
Correct.
What about kids? Obviously, kids can get depression too.
That's true. The numbers for kids are anywhere between 8 and 13%, and probably 50% or more are not receiving treatment for their depression. In kids, it can show up as isolation. A lot of times, it's more frequently seen as agitation and anger, irritability. In fact, the life cycle of depression in young folks, it often presents more as anger. In middle-aged folks, ourselves, it presents more as sadness. It can be both. And in the elderly, it can present more as agitation. So some folks in the nursing home, they may say, hey, look at that agitated old man. Well, it's not true. It may be, look at that older man with depression.
Right. And, there's a stigma with that's been around. I think that we're knocking down some of these walls, but it's certainly, I know some people are afraid to get help because they're like, oh, I'm not crazy. I know I'm fine. I can handle it, right?
That's correct. A lot of times, folks, because we all experience sadness, so folks think, hey, just don't be sad. Pull yourself up. But it really doesn't work that way. It's much more of a biological condition, and you can't just make your brain change.
Right.
You can't just say, just do it. It's sort of like asking me to say, well, Dr. Brown, slam dunk a basketball. Well, I'm a short guy, about 5'8". There's no way I can do it without some help. Just like somebody with depression can't do it without some help.
So if someone is depressed, what should they do about it?
Definitely should seek treatment if they're experiencing depression. And if you're a loved one of someone that's experiencing depression, talk with them about that. There's different types of treatment. There is therapy, talk therapy, words have powers. As I talk, I might say something that is pleasing, so chemical reaction occurs that releases certain chemicals, or if I say something that makes you upset, a different chemical reaction will occur. So that's where therapy actually can make some changes in brain chemistry. Medication therapy as well. So some do well with therapy by itself, some medication by itself, some medication and therapy, and as you mentioned, TMS is another treatment option as well.
And TMS, we talked about the new one, which is transcranial magnetic stimulation.
Very good.
See, I
Yes,
got that right.
you got it right.
And now we'll just say TMS from now on.
We will say
But,
TMS.
yeah, you actually brought a slide in to kind of illustrate what that's all about.
The slide, yeah, the slide does represent what depression is and the biology of depression. It's sort of how an orthopedist might say, here is an ankle, here is a knee, and looking at that. This is looking at the brain from a PET scan from the Mayo Clinic. So when looking at the slide, we see one side where it shows depression, and the level, blue is lower activity, and lit up areas are areas that are more active. And so this is looking at electroactivity, blood flow, and as you can see in the depressed brain, you see how it's very down in the areas in the back, areas of concentration, focus, memory, pulling upon positive memories. Very, very hard to do. On the right side, after successful treatment, for somebody that's without depression, you can see the lit up areas, and those are the areas that are involved in all those symptoms that I talked about before. So a person can't just wish themselves from the left side or the depressed side of the screen to the right side of the screen. And now we may get to the left side when we're sad for a little bit, but then we return back to the non-depressed phase. Those with depression end up staying in that depressed state much longer.
So how does TMS work? What is it actually, physically?
TMS is based on using magnets to create an electrical impulse similar to what medications do, similar to what's going on in the brain during depression and treating that. Tesla, actually, you may have heard about the cars, the Tesla cars, and Tesla was around about the time of Edison and discovered that magnets can create electricity. And so using magnets, an electrical impulse is occurring in that area of the brain, which is felt to be involved in depression.
Now, we talk about TMS, which obviously is a breakthrough, and
Yes.
it's something I think everyone's very excited about. But are there non-traditional treatments as well that people can do, whether it's breathing exercise or stuff you can learn outside of traditional to work in concert with traditional medication?
There are certainly things that can be helpful, but in a bona fide major depressive disorder, to do them in isolation probably isn't going to be enough, especially if you're starting to experience symptoms of suicidal ideation and things are getting worse. But certainly I recommend exercise. That's good for depression, that's good for anxiety. Eating right is good. Being around cheery folks is good, just as we talked about. Saying nice things can cause certain chemical reactions, and saying negative things, so negative folks can actually bring that about as well. The nice thing about, and I know you're going to talk a little bit more about TMS, and we have an individual here that's experienced TMS. Right. TMS does not involve medication. So a lot of the side effects that folks have from medication, such as weight gain, sedation, dry mouth, sexual side effects,
Sleep deprivation, there's a lot of different side effects that come with it, exactly.
That's correct. And remembering to take the medication every day, compliance, one of the big issues and concerns. There are no medication interactions when you're looking at TMS as well. So it is a nice option that we have now. And at CLM, we actually have a NeuroStar TMS machine, which is one of the more popular TMS machines. And each session is approximately about 20 minutes. You have the sessions once a day, 5 days a week for approximately 6 weeks.
Okay. And then after the 6 weeks, how long does it sustain or last before you have to come back and get another treatment?
For many, it can sustain, and that can be their course of treatment. And so each person is assessed individually.
Okay.
And some may need some maintenance treatment after that.
Okay. So somebody's sitting home, mom and dad, they have some concerns, son or daughter showing some of the symptoms, or getting to the point where at what point do they say, I need to get some help, and what do you do at that point?
Yeah, that's a great question. Typically, if someone's symptoms are affecting functioning, work, school, family, a lot of family discord, arguments, those types of things, that is when I would recommend seeking some help.
Now, in the event, say, it's an adult 18-year-old, so then it's not maybe living with mom and dad may not, but then the rules change, as you know, where then they're an adult technically, so any recommendations on that? If somebody's sitting out there saying, I can't, he's 18, she's 18, I can't do anything, what would you suggest in that situation?
Right. If they're not at risk of harming themselves, certainly if someone is at risk of harming themselves because of the depression, then they can involuntarily be treated.
Right.
But
that's almost a nuclear option, though, right?
That is,
there's no going back from that one. So
the majority of folks, I would recommend continuing to give them support,
right.
Let them know what's available, talk with them. Obviously, a person can't be forced into anything, but just giving them education and letting them know that you're there for them, that you care for them is very important.
Mental Health Matters. We're talking to Dr. Ken Brown here about depression, his specialty, and TMS, which is a new breakthrough treatment.
Yeah.
We're talking about, so say mom and dad are looking, so I guess more like, what if somebody's watching this that might be experiencing some of these symptoms on the fence? Maybe I don't need it. Maybe I think I can, or they're maybe starting the course of medication and self-medicating, saying, you know what, I think I'm all set with this. What do you say about that?
They started the medication, then they stopped.
Right. So I'm sure that happens all the time. They get into it, they go, or they take a bite of the apple, and then they step back.
Yeah.
And go,
Yeah. Well, certainly if mom and dad are watching, or mom and dad have depression themselves, they can contact Center for Life Management or any mental health professional agency and request an intake or an assessment as well. Those that may have started treatment and then stopped, a lot of times folks will say, I want to see how I can do without it. And I often tell folks, well, the medications in treatments can take a while to start working. Sometimes it can be 2, 4, 6 weeks. And so you really want to stick with it. And then when you're doing well, 4, 5, 6 months into it, you should continue with the medication. We do have guidelines on first episode depression, second episode depression, on when to start to decrease the medication or treatment. Many times, though, folks will say, I just want to check myself. And I tell folks, it's sort of like exercising. If you wanted to get in shape, you might start eating right, start exercising. In 2, 3 days, you look in the mirror, you're probably not in shape at that point. But 4, 5, 6 weeks into it, you're starting to notice some changes. Right. Now, 6, 8 months into exercising and being in shape, you're pretty much in good shape. Now, would you at that point say, I'm going to see about not exercising, not eating right? Okay, 2, 3 days, you look in the mirror and say, I guess I look the same. I don't have to exercise and eat right anymore.
Right.
Well, 6 to 8 weeks later, you tell me then what kind of shape you're in.
Right, exactly. That's a great analogy, by the way. So it's a great way to kind of parallel exactly what the process would be like. The other thing I want to touch on quickly before we let you go is the stigma of mental health and depression used to be kind of taboo. Ooh, don't talk about that. And it's much more in the open now. I see I'm on the forefront of what you're doing to really make the awareness and let people know that, hey, they're not alone out there, and there's a lot of help out there that's offered.
I agree. I think that's really key. The stigma that used to be there in the past is really dissipating. We now have a lot of celebrities that talk about their own mental health issues, and treatment's there, and no one should suffer alone and suffer quietly.
Right, and obviously with all the issues in the country, we're seeing a lot of this stuff manifest itself too, which is, I think it leads back to a lot of that mental health issues we're talking about.
Correct.
Well, Dr. Brown, it's been a joy. I know you're going down to Tulane to visit your daughter and see some football here soon, so thanks for joining us today, and we look forward to continuing your great work.
Thank you.
All right, we'll be right back with Todd Donovan. He's got a great story to tell you. Mental Health Matters continues right after this. Welcome back to Mental Health Matters. Joining us is Todd Donovan. Todd has experienced what it's like to cope with depression, and we thank you for being here today and sharing your story with us. Very brave man you are. So tell us a little bit about yourself and how you got here today, Todd.
Absolutely. My name is Todd Donovan, and I am a firefighter paramedic here for the Derry Fire Department. I've been with the Derry Fire Department for 17 years. My family and I reside in Chester, and I'm here to talk about depression and TMS.
All right, now, when did you first recognize that you were having a problem with depression and it affected your life?
For me, it was very early. At the age of 8, I attempted to take my life. At the age of 14, I attempted to take my life again also. In my late teens, I was found by a police officer and trying to take my life again. And that entered me into the mental health system. So I've had a long career, you can say, with depression. I am the most biologically based depression that my psychiatrist and psychologists have ever seen.
And you were able to eventually pull yourself up, but I'm sure a long road to get there.
Well, I've taken 11 different medications that did not help at all. And I've also gone through a trial of electroconvulsive therapy, or ECT. That did not help my depression at all. And I've also been doing cognitive behavioral therapy for a number of years. And that's what kept me alive for a number of years until I found transcranial magnetic stimulation.
Which we'll talk about. We have talked about earlier, but want to talk about you because you actually have benefited from that. But I want to mention, so you said the incident at 8 where you took the aspirin and tried to commit suicide. So you did that, but when did you recognize personally that you had an issue? I mean, was it then, or was it you don't know if that's normal or not, right? So.
I didn't understand what was going on at the age of 8.
Right.
I just knew I was very angry, and I just wanted to die. I didn't realize that I had a mental illness until after I got treatment that worked. I thought that I could pull myself up by the bootstraps. I thought if I went to college, if I became a paramedic, if I got married, here's the kicker: if I thought I had kids, that things would get better.
Check, we're all
yeah,
good.
it didn't. None of that happened. I still had the depression. I thought if I got organized, I thought if I ate my vegetables, that my depression would go away, and it never went away. And then when I got treatment, I realized, wow, I do have a mental illness, and that I need to manage it like I would manage diabetes.
Right. So I know the answer, but we should find out what kind of effect did the mental illness have on your family?
I am surprised we have not divorced.
Okay.
The treatment that I did receive and that worked not only saved my life, but it also saved my marriage.
Right.
And now we don't sweep any of these problems underneath the rug. We deal with them head on.
Well, you know, you've had a success. You're one of the success stories in this whole thing. Can you talk a little bit? We talked a little bit about the TMS and how it is for depression. How has it helped you?
Well, it was advertised in the paper one day, and my wife cut it out and put it up on the refrigerator. And I decided to go in for an appointment, and I was approved for the TMS. And so I went to there. It's kind of a commitment. You got to go there for 36 treatments. But for me, I see my own self-destruction, my own suicide in my mind over and over and over and over again. It doesn't matter whether I'm, no matter what I'm doing, I see my own suicide over and over and over again. But I woke up after treatment number 22. I woke up in the morning with no suicidal images. And that was an extremely strange situation for me. I had never experienced that before.
First time in your life.
First time in my life. And I laid in bed for an hour conjuring up these suicidal images. And every time I would stop thinking about it, it would go away. And now, that was bizarre. I had never experienced that before in my entire life. And so I noticed that same day, it was the fall, and I noticed the orange and the reds in the leaves. I'd never experienced that before. And then as the time went on, I discovered music. I'd never listened to music growing up. It was not important in my life. I didn't have any joy from it. Now music is an incredible part of my life. And people. I never really had friends. Now I have friends, and I can be a friend to people. The same thing with my marriage. I am now present in my kid's life, and I'm now present in my wife's life, which I never was.
And that has to be a great feeling for you. What about your family you grew up with? Obviously, they went through a lot as well.
They did. My parents really didn't understand, nor did they really know how depressed I was. I just turned 50 years old. It's not something that was on their radar, really, at all. So they didn't know what to do for me. Nowadays, there are so many treatment options for depression that, and the stigma, we're trying to reduce the stigma of this. It's not your fault. It's no different than diabetes. You know, what's fascinating about diabetes is when your pancreas stops secreting a chemical, we can give you insulin to replace that.
Right.
It's the same thing with your brain. When your brain doesn't fire appropriately, or there's a chemical imbalance, we call that depression. And it is no different than diabetes. And it has to be managed like diabetes. It has to be managed aggressively.
You know, and you bring up a great point because, you know, I think a lot of people you got to stay in it for the long haul, but you basically decided to manage this illness and take the time to go through the medications, because there's so many different medications out there and so many different ways to attack this. Just trying 1 or 2 pills and going, well, it doesn't work for me. You have to take control and make sure that it's going to work for you, but find the right combination, whether it's exercise or some other mental exercises and medication to make sure it can help you.
Correct. I did a lot of different things. I did talk therapy, cognitive behavioral therapy, and I also tried a variety of medications. There's a lot of science involved in this, but at the same time, there's a lot of art to it. And you have to really trust your provider to help you through those things. And you don't want to give up on those medications right away because it could take a while for them to work.
Now you talked about, obviously, when you were growing up with your parents and the stigma that's kind of been stuck with it, although I feel like we're evolving now finally. There's a lot more education. I think a lot of parents now, so if they're sitting on the audience, can say, okay, maybe I should talk to my son or daughter about this now because they're aware of this is why they're exhibiting this behavior.
And it's one of the things that we have done in our family. There's an hereditary component to depression. And of my 4 children, 3 of them are being treated for mental health issues.
Okay.
We don't sweep it under the rug anymore. We hit it head on. Treatment worked for me. They saw it pretty impressively, that the treatment that finally worked for me in such a way that they saw such a big change in me that they couldn't ignore it. And so now we don't sweep that stuff under the rug. It gets dealt with.
Okay, if somebody's out there maybe struggling with depression or other mental health issues, what kind of advice would you give them of how to seek treatment, how to manage this thing?
Sure. The one thing that it's easy to say, it's hard to practice, is you can't give up.
Right.
You just can't give up. I had a suicide note taped in my locker at the Dairy Fire Department. It was, you can see how insidious that was. I am, now that treatment has worked for me, I'm thoroughly embarrassed that I could have put my coworkers and my family through a suicide. But my advice to people is, one, treatment does work, and not to give up. I am living proof that treatment works. I am surprised that I'm still here and still alive. But treatment works.
Well, and you know, the strength that you're showing, I mean, to do what you've done, and again, to have one of the more severe cases of depression, and then be able to pull out like this because you stuck with it, but you also had support from family, and that's very important to have a nice support structure around you as well.
Absolutely. Absolutely.
All right, anything else in terms of the TMS and I know you said it's like what about a month of treatments, but
right.
we have to go back again, or is it basically just waiting to see how it plays itself out?
Yeah. Well, for me, I see my psychologist every 2 weeks.
Okay.
And I also see my psychiatrist every 3 months, and I take 2 low-dose medications still, and then I go to maintenance treatment of 1 TMS treatment every 4 to 6 weeks, whether I need it or not. There are some times that I need that treatment because those suicidal thoughts begin to creep in, but there are times when I do great, but I go to my treatment anyways, and I just do it.
You know, it struck me when you said, you know, after that final treatment the first time, when you were sitting there for an hour and all of a sudden realizing that, wait a minute, I don't have to, my brain's working right. It's not making me think that way.
No suicidal images at all.
What did that feel like when you, and then be able to experience things like more happy and seeing the colors on the leaves? And it's almost like when I put glasses on for the first time in 5th grade and went, oh my God, what have I been missing?
What have I missed? And
right.
that's what my wife and I have discussed this, you know, quite a bit. Mm-hmm. We missed out on a lot for years, and we are in the process of repairing our relationship because the depression was so insidious. There's a lot of opportunities that I see. I'm going to be testing for promotional process of the Dairy Fire Department. I never thought I would ever do that, but there's a lot of exciting things that are happening in my life, and it's attributed to treatment.
Well, you know, you're a tower of strength, and obviously an amazing individual to do what you've done.
Oh, I appreciate that.
Obviously a tip of the cap to your wife and your family, because they obviously have been a big part of your support group to get you where you are. But it's great to know that there's this success and that you can pull yourself out and contribute and actually feel good about yourself again. And there's hope out there for people. That's what we want to let people know, that there's help and hope.
And there's sometimes that, you know, maybe it's just talk therapy, maybe it's medication, maybe it's a combination of the things. Maybe it's TMS and medication. You just can't give up.
Well, Todd, it's been an inspiration here talking to you today.
Thank you very much.
Keep the speaking up.
Keep
it up. Okay.
Thank you.
The Center for Life Management has locations in Derry and Salem. To contact CLM, you can call 603-434-1577 or visit them online at centerforlifemanagement.org. To reach CLM's 24/7 emergency service, please call 603-434-1577, option 1. Thank you for joining us for this edition of Mental Health Matters, and thank you to Dairy Dairy Community Access Media, empowering independent voices. I'm Chris Garrett, and we'll see you next time on Mental Health Matters.